So depression, which is also known as major depressive disorder, again, it's a mental health condition that is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities. So if you're experiencing that, I want you to really spend some time listening to what we're sharing with you today. Depression can be categorized in different types. We have major depressive disorder, and this is one or more major depressive episodes in a lifetime that last at least 2 weeks. We have persistent depressive disorder, and this is a low, sad, or empty mood lasting at least 2 years, right? We have postpartum depression, and this is depression occurring in women after childbirth. That's right. We all say that childbirth is a happy time, right? And a lot of women long to become mothers, but some women will experience postpartum depression after giving birth, so much so that they may not even want to interact with that newborn. Then we have what you call seasonal affective disorder, and this is depression that occurs in the winter months. And then you have bipolar disorder, and this is when a person has episodes of mania. They have a lot of energy, racing thoughts, and then they can suddenly experience episodes where their energy is very low and they're feeling depressed.
Or shut down completely.
Shut down completely. So these are some of the types of depression that you'll hear us make reference to in this conversation. In order for a person to be diagnosed with depression, you have to experience symptoms, right? Specific symptoms, right? So you're going to have at least 5 of the following symptoms, but it has to include at least 2 of the first symptoms I'm talking about now. So 1, the person has to have a depressed mood. So again, they're feeling sad, they're feeling empty, they're feeling hopeless, or they also have that loss of interest. That means that, activities you used to enjoy, you just don't want to be bothered by them anymore. So you have to have at least 1 of these, right? And then now, in addition, that person may be or should be experiencing at least 4 of these other symptoms.
So you're telling me if I were like a person who used to enjoy to go out on weekend, to hang out with friends or go to a movie or what have you, and all of a sudden, so it's like I stopped doing those things. I don't find any interest into doing them anymore. So that would be a time for me to check myself out.
Check yourself, because now we still have to consider these additional symptoms that include weight changes. You may have someone lose a significant amount of weight, or they may gain a significant amount of weight. You may have sleep disturbances. Someone suffers from insomnia, or on the other side, that person is just sleeping all the time. The person may be fatigued, where they have no energy, or they're complaining of feeling tired all the time. That person may experience feelings of worthlessness. They don't feel like they matter in this world. That person may also have brain fog. They have trouble thinking, concentrating, or making decisions. And lastly, again, if the person is having thoughts of suicide. So if you know someone who's experiencing these symptoms, or maybe you are experiencing these symptoms, it's very important that you seek out help from your doctor, or you look to get evaluated by a mental health provider. Okay.